alaikum. But first, I'd like to bring on Hamid Khan, we're so pleased to have him with us tonight. He's the Executive Director of CAIR Alabama and former Deputy Director of the Rule of Law Collaborative at the University of South Carolina. Mr. Khan has consulted the U.S. Department of State on rule of law related matters related to Islamic law. He served as the National Security Fellow for the Truman National Security Project and served as a source expert for the International Network to promote the rule of law. While in private practice, he served as counsel of record for 5 detainees held at Guantanamo Bay and was assistant U.S. attorney for the District of Colorado, as well as a law clerk to the Honorable Terrence L. O'Brien, U.S. Court of Appeals for the 10th Circuit. Mr. Khan had a distinguished career before law school as a Harry S. Truman Presidential Scholar, worked for the U.S. House Committee on Transportation and Infrastructure, the Office of U.S. Senator Alan K. Simpson, the Office of David Alton in the British House of Commons, the Office of U.S. Representative Barbara Cuban, and was appointed to the Wyoming Advisory Committee to the U.S. Commission on Civil Rights. Hamid, it's wonderful to have you on the show tonight. Thank you for taking time to spend with us in a week that U.S. officials have warned will be the worst week yet for Americans. The death toll has reached 12,000 as doctors are put in a position to make life or death decisions with limited resources to manage the overwhelming need for critical care patients. We're hearing pushback at the federal level. Trump walked back on some statements. I want to ask you about that. But first, I just want to say hello. Are you there, Hamid?
I am.
Great. How are you doing tonight?
I'm doing well. Thank you for inviting me.
Thanks for being here. You're an expert in this area, which is, it's going to be so great for our viewers. I'm hearing a lot in the news. We all are about, this kind of tussle between the federal governments and state governments. Trump is pushing back at the federal level. He's walked back his comment that everybody who wants to get a COVID-19 test can get one. Then he walked back and said, it was yesterday, it's not the federal government's job, he said, to stand on every corner handing out COVID-19 tests. And governors, meanwhile, are really unsettled at the lack of coordination. Governors are competing for life-saving equipment and devices on the private marketplace. And Trump said to a reporter just yesterday, his response to the question, what more can the federal government do? Why isn't it doing more? He said, have you heard of this thing, called the Constitution, something along those lines. So as the expert, my question is, what is the Defense Production Act, DPA, and what does it permit the federal executive branch to do?
Well, the DPA is a byproduct of the Truman era and really found its roots during the course of World War II. It authorizes the president to use the instrumentalities of business to produce weapons in some cases, but other essential needs for the defense of the national security of the United States. The act has been invoked over several periods of time by various presidents, and particularly members of Congress have brought to bear pressure on the president to invoke the act and use the act to produce various products in the service of the pandemic now gripping America.
Mm-hmm. So what would you like our viewers to know about the act going forward, and what is its relationship with this kind of this conflict that we're seeing play out between local powers and federal government? What should we think of all this?
Well, the history is so far has been replete with the same confusion that are many of the press conferences that we've seen in front of the White House. First, the president was avowedly reluctant to use the act to ask manufacturers and companies who had the capability to produce specifically ventilators, but more broadly, all the various aspects used to combat the pandemic. Initially, he signaled that his intent was to persuade the companies that by merely invoking the act, rather than actually using it and signing an executive order, that those companies would come to the table and actually do so. In an outward conflict that he had with GM on Twitter, he finally decided that he would just simply sign the act and actually order them to produce ventilators. Now, that production is now underway. Of course, that requires retrofitting on the part of GM and other instrumentalities. But now the challenge for many of the healthcare workers, of which we will be joined tonight, is to produce and include the mass production of personal protection equipment. So beyond the ventilators, we know the frontline workers. We also know that there are many individuals across America in the service, paramedics, EMS, all types of different, who require the use of personal protective equipment. And asking the experts themselves, doctors will tell you that in order to abide by infection protocols, doctors can't be limited to the use of an N95 mask for an entire day, let alone for an entire patient. And many are wondering, particularly those in Congress, but governors across the country, when the need is so great and when the expected need is to be ever increasing, why the president doesn't use the DPA for this particular use.
So constitutionality, in response to Trump's comment yesterday for our viewers, it sounds like you're saying, that doesn't add up as a legal expert.
Well, one of the challenges that we face in our system of government is one of federalism, right? Where the federal government steps in, and of course, states have sovereignty. What we've seen on the national level is a consistent message where avowedly the federal government seems to step back. And that stepping back is to sort of cede power to the states. But as we all know, when it comes to matters of national defense, when it comes to matters of interstate commerce, the federal government is deemed to have plenary authority. And legally speaking, even constitutionally, from the vantage point of the 10th Amendment, pandemics and viruses don't simply abide by state lines. They traverse the country. And as we all know, even riding on an airplane, we cross state lines very easily. So it seems very glaring that what we've seen are governors stepping up, particularly because the federal government, despite its consistent attitude and despite its legality to enforce national measures, has decided not to do so.
Well, they're going to have a lot of explaining to do. The legal experts clearly understand the rule of law. We'll see what happens in the coming weeks. Thank you so much, Hamid, for joining us. It's such a pleasure to spend time with you. We're so happy to have you and the CAIR family. Is the executive director again of CAIR Alabama. It's great to have a legal expert in the house. I hope you'll join us again.
Thank you very much.
So next we'd like to bring, it's with a great pleasure to introduce you tonight to Dr. Zahir Sahloul, who is a world-renowned pulmonary and critical care specialist. Are you with us, Dr. Sahloul? There you go. All right. How are you doing tonight?
Oh, good. Tired, exhausted.
Yeah.
I'm still in the hospital actually, but I feel fulfilled. My specialty is pulmonary and critical care medicine. I've been practicing in Chicago.
Oh, yeah. I want to make sure we could get a good frame of you. I want to introduce you, if it's okay, properly, because really your resume is standout and really represents the best in our community. You're a world-renowned pulmonary and critical care specialist. You were born in Algeria, a native of Syria, and now living in your hometown of Chicago, where you work on the front lines right now as we speak, battling against COVID-19. You were past president of the Syrian American Medical Society, which everyone knows so well, SAMS, and founder of the American Relief Coalition for Syria. And under your leadership, Dr. Sahloul led the organization to be one of the most important medical relief and advocacy organizations providing medical relief to Syrian refugees. Dr. Sahloul was awarded Chicagoan of the Year in 2016 for his humanitarian work. In addition to his professional career as a critical care specialist, Dr. Sahloul is the president of Med Global, which provides sustainable healthcare services to refugees and vulnerable patients in crisis areas with low resources around the world, through deployment of medical missions and through partnering with grassroots efforts. It is truly a privilege to have you with us tonight. You're a true American hero. You have served in crisis zones and now saving lives. You continue to sacrifice to save the lives of critical care patients. How are you doing tonight?
Alhamdulillah, I'm doing very well. Tired, but this is expected in time of crises. Every colleague of mine, physician and nurses, are stepping up. This is not normal time. This is disaster time, exceptional time. We only had 4 pandemics in the last 100 years. This is the 4th. And in pandemics, doctors and nurses and administrators, technicians in the hospital are expected to work harder. So I feel that we're doing what we're supposed to do. We're not doing anything beyond our duty. So we're not heroes. We're not things like that. This is what we are, educated and skilled to do, and I feel very fulfilled.
I hope it's okay if I insist on calling you an American hero. I truly feel that way. Just in today, we saw in Chicago, Mayor Lori Lightfoot, she signed an executive order, which is guaranteeing now immigrants and refugees in Chicago access to all of the same relief resources of their fellow Chicagoans. Really exciting news. Please describe what it is like for us, what it is like for you, what is it like for those on the front lines and critical care patients with this disease, and knowing as much as you do about refugees and critical care, what also is that aspect like?
In my hospitals, I practice in two hospitals. One of them is a small safety net hospital. We call it safety net because it serves the underserved community in the west south side of Chicago. It has 15 ICU beds. It has only 18 ventilators. It's overwhelmed. And unfortunately, patients who are admitted to that hospital do not have the same quality of care like the other hospital that I'm practicing in right now, which is called Christ Advocate, has 250 ventilators. We have plenty of ICU spaces. We have the best specialists and the best resources. So, and what we've noticed in the last couple of weeks, we're seeing more and more patients. In my hospital right now, we have 250 patients with COVID, 250. And every day we're having 40 or 50 new patients coming. Many of them are very sick. It is affecting the African American community higher than the non-African American community for many reasons. The first one is that they have lower access or poor access to health care. They are coming late to the hospital because there's not enough testing. And by the time they are coming to the hospital, they are sick and more sick than usual, and they end up in the intensive care unit. They end up on the respirators. They have many comorbidities, hypertension, diabetes, chronic kidney disease, chronic lung disease, and obesity. Obesity in particular is a risk factors for death in COVID. And that's why we have higher death among the African American community and also the Latino community than the Caucasian community, which is very distressing and very disturbing. And I'm happy that the mayor of Chicago, the governor, are paying more attention in the media to disparity. This is not an equalizer virus. We thought that this is a virus that affects everyone the same way. I mean, based on the reports from Italy and China and Spain and other parts of the world. But in the United States, it's not an equalizer. Disenfranchised communities are getting the brunt of the crisis and the pandemic.
You have practiced medicine under so many conditions, Dr. Sahlul. I've read about you practicing medicine in basements and bombardment areas of Syria hit by the Syrian regime and Russian forces and proxy warmongers at points, treating them in basements because the hospitals were targets of the regime. You really put your life on the line throughout your career for your patients. What are some of the parallels, if any, going on right now between, what you've done in the past, which, you continue to do, and where you are right now?
Disasters are disasters, whether it's war or man-made or pandemic. What happens in disasters that at one point the healthcare system is overwhelmed, and we call it level 3 disasters, that even with expanding the capacity of your hospitals and getting more resources, then you will not be able to treat every patient and save every life. And this is what happened in Syria over the last 9 years on a daily basis. And this is what's happening right now in Italy, Spain, and also in the United States of America. We do not have unlimited resources. So right now we are dealing with limited resources, whether it's PPEs or N95 or ventilators or medications for COVID, the same way that doctors and nurses in Syria have dealt with limited resources for the last 9 years. There are many parallels. To me, it's very surreal that the principles that I practice and with my colleagues in Syria over the past 9 years, we were hit with barrel bombs, where you have communities under siege and they have very limited resources, where you had chemical weapons used in Syria. The same principles applies here. First thing, that you want to protect healthcare providers, doctors and nurses. In Syria, more than 900 and 20 doctors and nurses were killed by the Syrian regime and the Russians and the Iranians, according to Physicians for Human Rights. More than 580 hospitals were bombed. So at the peak of the chemical weapon attacks in Syria, I remember in one of my medical missions, I took with me a bag full of face masks, but gas masks to protect physicians from exposure to sarin gas and choking agents. And it went through customs in Chicago and in Istanbul without any questions, which I thought that was a miracle. But physicians in Syria died because of exposure to sarin gas and to chlorine gas because they did not have PPEs. And we have physicians now in Italy and in the United States dying because they do not have adequate PPEs. My colleague just yesterday, who is a critical care specialist, had fever in the morning and he was treating patients with COVID and he tested himself and he's positive. And this is one of many examples because we do not have adequate PPEs. The administrator in my hospital is asking us to use the same N95 over and over and over. We used to use it for every encounter with the patient. So if you see the patient multiple times in that day, then you have to use N95, new N95 every encounter. But right now we are asked to reuse the same N95, which is not the ideal situation.
Wow. It sounds like you said you're surprised to find the parallels. You've voluntarily served in crisis zones. You continue to serve right now, but it is strange that in the United States of America, we wouldn't have the resources that we need to protect those on the front lines and to serve critical care patients. We're getting some questions on Facebook, and they want to know what you would like to see in the next stimulus package.
I think we need to resurrect the early warning for pandemics that were removed from the previous, by this administration, but Trump's administration, which would have allowed us to detect this pandemic and deal with it effectively. I mean, everyone in the medical community that there is a delayed response of this administration to the pandemic. We had enough time to see what's happening in China and Italy. We had enough time to have enough testing to be produced. Until now, in St. Anthony's Hospital, for example, which is safety net in a hospital in Chicago, it takes 2 weeks for the test to come back, whether it's positive or negative. 2 weeks. That means the patient and the healthcare providers are not able to know whether this patient has COVID or not. So more resources directed towards healthcare and pandemics and crisis management, disaster management, management of non-communicable diseases which are killing our communities, whether you're African American or Latino or immigrants. These are the killers, whether during the crisis and outside of the crisis. And this is magnified with the COVID because patients who have non-communicable diseases, chronic diseases, are dying now at higher frequency because of COVID. But the underlying problem is the long history of ignoring this disenfranchised community that led to food desert that is leading to obesity and hypertension and diabetes and chronic kidney disease.
What can we do? Another Facebook viewer is asking, there's so many questions for you. What can we do to protect Syrian refugees and other vulnerable and displaced populations for those of our viewers who are listening, hearing your message, and they want to do something about it?
I think supporting organizations that are providing services to the refugees in general is very important, because what happens in time of crises and this is maybe normal human reaction, that everyone will pay attention to themselves and to their family, and they forget people who are in need, whether they are elderly or disabled or refugees or displaced people. So please, please, please pay attention to the refugees. They do not have the luxury of social distancing. Yesterday I was speaking with one of the doctors in Idlib province, Dr. Walid Tamer, and he was telling me about a young refugee woman from Idlib who had signs and symptoms of COVID. And he told her that she needs to self-quarantine herself. And she looked at him as if he was speaking gibberish. And she told him, I live with 15 members of my family in the tent. How can I self-isolate myself? People in the tents, the refugees and the displaced, do not have clean water and soap to wash their hands. They do not have the luxury of social distancing. And this is, by the way, similar to people in disenfranchised communities in the United States. In the west side of Chicago and south side of Chicago, we have similar problems where you have people who are crowded in small apartments and they cannot have social distancing. They have to work every day, so they cannot afford to stay at home. So these issues are important, and our community should be more generous toward these the oppressed and disenfranchised community in the time of crisis, because that's what our Prophet did, than in the time of peace.
Sallallahu Alaihi Wasallam. Thank you so much, Dr. Sahlul. Hearing about these parallels is very striking and honestly hard to believe, that this is happening. And it's reassuring that there is something that we can do. Look beyond where we are. Be grateful for what we do have, our blessings, and if we have some rizq, share it. Where can we find the organization that you're president of, Med Global?
Medglobal.org, www.medglobal.org. We provide services to the refugees in Yemen, displaced in Yemen, victims of war in Syria, in Gaza Strip, Rohingya refugees in Bangladesh, Venezuelan refugees in Colombia, the refugees in Greece and other places, of course. But also Syrian Community Network is providing services to the Syrian refugees in Chicago, Atlanta, and other places in the United States. Both of them are worthy of our support, and many other organizations, of course. I think it's very important also to take care of our mental health. I'm talking about healthcare providers and also everyone else, because in time of crises, it hit us hard. And sometimes we do not pay attention to what's happening in our spirit and our mental health until it's too late. So take care of our mental health, practice meditation, prayer, dua, reading the Quran, sport inside the house, of course, and that will help us. And if you identify early signs of anxiety, depression, PTSD, please seek help. It is important that you seek help early than wait until it's too late, because these things will creep under our skin and it affect us for the long term.
I can't help but ask you a practical question that viewers want. You are a pulmonary specialist. This is attacking the lungs. What do you advise people who are, getting symptoms of COVID-19? I heard recently, don't curl up in the bed. Don't do exactly what you want to do. You need to get up and move a bit, drink a lot of water. What are your what's your advice for those who think that they might have it again? Because a lot of people don't know, they're not getting tested, in order to try to stay healthy and out of the hospital and out of critical care.
I mean, the first thing, that do not panic, because 8 out of 10 of patients who get COVID have mild symptoms, flu-like symptoms and cold-like symptoms, some fever, some muscle aches and cough. So don't be alarmed, because that's 80% of people won't have to come to the hospital. You should not actually come to the hospital to infect others or to expose others. Practice self-isolation or self-quarantine if you have these symptoms. Take some Tylenol fluid, and rest is more than enough. If you started to have shortness of breath, this is an alarming sign. So shortness of breath, that means you are getting low oxygen. That means your lungs are getting inflamed or you're developing pneumonia. So when you start feel breathing heavy, then you need to seek treatment and come to the emergency room, to the hospital. Don't wait too long, because I've seen community members and of course other members who come too late, and by the time they come to the hospital, then they are in the intensive care unit. They're required to be in the respirators. Really, there's nothing magic. There's no medications, and there's all kind of these formulas that are on social media that do this and do that. Nothing really works in this virus until we find a vaccination or a treatment. So far, there is no vaccination nor a treatment. So stop smoking if you're smoking. I think that's very important. Wash your hands frequently. Cover your mouth and nose when you cough or sneeze. Self-quarantine yourself if you have symptoms of flu. And if you have shortness of breath, or if you feel dizzy, or if you feel tired, very tired, then and with very high fever, then you come to the hospital.
What about chloroquine? I don't know if I pronounce it correctly. I've heard it so many times, I feel like I should be able to. I saw the president at a press conference saying, why not try it? It's what can you lose? I have a friend who has lupus, needs the medication, to treat that condition on a regular basis. As a treating physician, what do you think about that statement?
Hydroxychloroquine or Plaquenil is an old medicine for malaria, but it's used also for lupus, as you've mentioned, and for rheumatoid arthritis. We are using it actually for every patient who is admitted to the hospital with severe symptoms. Although the evidence that the use of chloroquine is very small, there's only one small study in France that showed that there's some impact on patients. There are larger studies that are being done. I tend not to believe President Trump when he talks about science. I tend to believe medical reports and journals and facts. We have to wait to see whether really it's effective or not. There is no reason to use it prophylactically, so don't use it. Don't ask your doctor to write it for you if you do not have any symptoms. We have to conserve it only for patients who need it, and also for patients who have SLE and rheumatoid arthritis who need that medicine, and it's life-saving for them.
Yeah. Right. The supply is low because of that. You've been very generous with your time. Thank you so much. If I can just ask you one more question, if you could put one thing on a billboard for all of our viewers, inshallah, this video will be played. It's being played now live and will be played again to others. So hopefully a lot of people will view and hear your advice. What would you say? One thing on a billboard.
I mean, I would say that this is a serious disease, so pay attention to it. Do not ignore your symptoms if you have shortness of breath. Follow up the advice of CDC and the local health authorities and practice the social distancing. Do not come out of your home unnecessarily, and take care of your family, take care of the poor, take care of the people who need you, and be more generous in the time of crisis. The Prophet was more generous in time of crisis than other times. And also, we are coming to the month of Ramadan, which is the month of generosity and the month of fasting. So please make sure that you also dedicate part of your income to the people who are in need. And also take care of your healthcare worker, whether they are nurses and doctors. These are the people who are in the front line every day. They're not doing it because they are heroes. They're doing it because they are it is their duty. But make sure that you show them some appreciation and respect, because they are saving many lives.
For sure. Thank you so much. I really appreciate it. I hope that you get some rest before you get back up and do it again. You're in our du'as. We thank you and love you. Again, I say you're a hero. Pardon me for insisting on it, but thank you so much for joining us.
You're welcome. Thank you. Thank you.
Assalamu alaikum.
Salam wa rahmatullah.
That's our show for tonight. I hope that you all will join us again tomorrow. We're going to have Hurting but Helping How to Provide Charity During a Pandemic with ICNA Relief and Penny Appeal. There's the flyer right there, which really segues very nicely from what we spoke about, tonight. Dr. Sahlul, as he said, the Prophet sallallahu alaihi wasallam, he was more generous during crises. This is a good time to give. And as we approach Ramadan, giving what you love is the most difficult thing to do, but the most loved thing by Allah subhanahu wa ta'ala. So thank you for joining us. We hope that you learned something tonight. If you did, like this video, you can join us every night, 8 o'clock. We're on Facebook Live, share it with your friends. You can go to our website, www.cair.com, CAIR. You can also go to our newest website, which is the CAIR Newsroom, CAIRnewsroom.com, where we have lots of information, expert information, facts up to the minute, data, so that you can stay on top of what's going on. Again, join us tomorrow night. May Allah subhanahu wa ta'ala be with you. Keep your family safe. Keep us in your du'as. Have a good night.